Yesterday on the program, I was talking about I would like to be able to provide health care for my employees. I only have one, two, three, four, five, really, I guess six total employees if I count myself. I'd love to be able to provide health care for my employees, but I can't. It's too expensive. I don't make enough money with my radio syndication business right now. We're on less than 100 stations, hoping to get to 100 by the end of the year. But we don't make enough money for me to be able to provide health care. And I was talking to a friend of mine the other day who's a CFO for a private school in my town that has a couple hundred employees. And he said that they're having massive insurance hikes for the company. If you're a large business in this country and you have over 1,000 employees, you can get a reasonably good nationwide insurance policy, particularly if you're spread out across the nation. You actually can it's still expensive, but it's easier for you if you're a multi-thousand person company with employees across multiple states to get a healthcare plan than it is if you have like 10 employees or 100 employees in a single state. It's extremely expensive. A friend of mine who actually works just down the street from where I'm broadcasting took over his father's company. His father, Tom Wagner, was a dear friend of mine and my wife's. And my wife was the assistant to the president of Mercy University for a number of years, my alma mater. And they used the company core management to handle their insurance. They were self-insured essentially, and they structured an insurance plan. And Tom sadly passed away a number of years ago. Great, just phenomenal man. His son took over the business, and we were talking not that long ago about it. And he says he's just advising more and more really small businesses that you're going to have to pay your employees a little extra and put them on Obamacare, that there's just no financially viable option anymore for small businesses. There used to be before Obamacare. There used to be options for small businesses to be able to pay employees and give them meaningful health insurance. The problem is Obamacare by design was designed to drive up healthcare insurance premiums. Why? Why would the government design something? Because what was the end game? According to Barack Obama, Obamacare, the Affordable Care Act, was a halfway point between what we had and what he wanted, which was government-controlled health insurance. The Democrats, particularly the socialist left, fundamentally believe in government-controlled health care in the United States. And what the Affordable Care Act was designed to do was to not make it affordable. They did the same word game as the Inflation Reduction Act that Joe Biden did. The Inflation Reduction Act actually didn't reduce inflation. It made inflation worse. The Affordable Care Act actually didn't make health care affordable. It made it more expensive. It's the word games that the left plays, even when they do legislation. The intention of Obamacare was always to drive up the cost of privately funded insurance so that employers could no longer afford to give it to employees, which would create a national demand for a government takeover of the healthcare sector. It's what the Democrats want because the Democrats idealize Scotland and England and Canada and countries around the world with government-controlled healthcare. There are a lot of problems with government-controlled healthcare, including that it doesn't work well in those countries. Now, there are lots of people who will tell you it works well, but if you're someone with a critical need in those countries, good luck getting in. In Canada, at this point, you're more likely to get a prescription for euthanasia than you are chemotherapy, it seems. It's a little bit of exaggeration on my part, but not far. You have people in Canada, veterans who suffer PTSD, they offer them euthanasia as an option instead of therapy. That is not an exaggeration. Let's start with the starting point here. The United States has 340 million people. We represent 4.1% of the global population. China represents 17.2%. India represents 17.3%. The United States, for perspective, the United States of America is the third most populous country on planet Earth. You have 1.41 billion people in India, 1.40 billion people in China, and 340 million people in the United States. You know who number 4 is? Indonesia, 284 million people. Pakistan has 241 million. Nigeria has 223 million. Brazil has 213 million. Bangladesh, 169 million. Russia, 146 million. Mexico, 130 million. We are the only first world nation because I don't include China. China's a third world nation that thinks it's first world nation. We're the only first world developed nation on planet Earth in the top 10 for population. The second first world developed nation is Japan, and it's number 11 at 123 million. You have to scroll all the way down to number 20 for the United Kingdom. 69 million people. We're 340 million people. The United Kingdom is 69 million people, or 0.8%. In the United Kingdom, they are far more homogenous. Despite all the talk about the Muslim takeover of the United Kingdom and the colonies and the like, the United Kingdom is far more homogenous than us. Canada is even whiter than the UK. It's only got 41.6 million people, or 0.5% of the global population. And the left loves the Scottish healthcare system. They've got 5.5 million people. We have 340 million people. Scotland has 5.5 million lily white people. We have way more people from way more places all over the United States in rural and urban divides. And healthcare, by the way, is not a federal government power. It's a state power. And you have to remember, Obamacare was salvaged by John Roberts as a tax. I don't think that the federal government actually has the power to offer universal health care. I still think Obamacare should have been declared unconstitutional, and I think John Roberts learned his lesson, playing it too clever, thinking Mitt Romney would get elected in 2012 and fix the thing, and that's why he bought the GOP a lifeline. And what has the GOP done with the lifeline? Absolutely nothing. The Republican Party in the United States has offered no substantive alternative to health care from Obamacare. Absolutely nothing. There are certainly think tanks out there who have proffered ideas, and many of them are health savings accounts, and, we shouldn't actually pay for oil changes any more than we should pay for your annual checkup. You should have to pay out of pocket for that, and that would bring the price down. I mean, we've got some we got a circle of jerks in Washington, D.C. going blind in the bathroom, and think tanks coming up with unpractical ideas for dealing with health care on the Republican side. There actually are some things Republicans could do to deal with health care. There is some data first, and I want to read you a tweet. This is from Amy Klobuchar. Early retirees. This is a CNBC article she's linking to about a couple named Bill and Shelley. Early retirees like Bill and Shelley will see their health insurance premiums increase nearly 300%, from $442 to $1,700 per month if congressional Republicans refuse to extend the enhanced tax credits. That's an extra $15,000 a year families can't afford. Now, you should note that Amy Klobuchar actually voted to get rid of the Obamacare subsidy that was extended during COVID, and now she wants it back. So Bill and Shelley's health insurance premiums increased nearly 300% if the subsidy from the federal government goes away. Bill and Shelley Gall say they'd be rich if it weren't for their medical bills. How sympathetic. This is the actual story she's linking to. The early retirees who are on an insurance plan purchased through the Affordable Care Act marketplace spent upwards of $20,000 on health care expenses and insurance premiums in 2023 and 2024, largely due to chronic health issues and emergency eye surgeries. The couple's on pace for a slightly smaller sum this year if they're lucky. But next year, the Galls, who live in Meridian, Idaho, are bracing for their costs to grow significantly. This actually doesn't sell Obamacare, does it? Shouldn't it? Now, here's the galling thing, and this is a reply. This is from a guy, his Twitter account is Investor Nick. No wonder younger Americans hate the boomers so much. These people retired early in their 50s. They're getting a $127,000 a year pension plus Social Security. They got their cake and their cookies on the side. Imagine being in your 20s and 30s struggling and then reading this kind of stuff. Look at the comments. So they're in their early 50s. They retired early. They get over $100,000 a year in pension, and now they're having to pay their own insurance costs, and they're upset. They don't want to go back to work. They just want you and me to pay their health care bills. That's what they want. These are the sympathetic people Amy Klobuchar is highlighting. According to the Wall Street Journal, the average cost of a family health insurance plan is nearly $27,000. The cost rose steeply a third year in a row, reaching just under $27,000 for a family plan. This is a 6% increase from the year before and builds on 2 prior years of 7% gains. The cost is rising faster than inflation, and economists and business leaders says it could bite into employment and wage growth. If healthcare costs go up faster than the economy in general, that means there's less money left over to go to wages. J.H. Barra Paving Company in St. Louis is struggling with this trade-off. The company is facing a 15% health insurance rate increase this year on top of last year's increase. That extra cost is likely to put a lid on wage increases for the company's workers. They've got 1,860 employees. Or sorry, a KFF survey, which includes more than 1,860 employers, was completed earlier this year, offering a detailed snapshot of workplace insurance. Nearly half of the U.S. population gets health care coverage through a job. The rising cost of employer coverage is driven by higher health care spending. Insurers and employers point to rising rates of conditions, including cancer in the working-age population. Hospital prices have gone up as health care providers have negotiated higher rates of their contracts. Employers are seeing increased outlays on new and costly therapies, particularly the GLP-1 weight loss drugs. You know, there are some ways Republicans could lower costs. They could get rid of the mandates. Do you know if you're a man and you get on an Affordable Care Act plan, you have to pay for your pregnancy? You have to pay for mammograms? You got to pay for your own pap smear if you're a dude. And I'm talking like a real dude, not a trans dude, but you're a real human being, man, born as a man, identifying as a man. You still have to pay for a pap screening test you'll never use. You have to pay for a mammography test you'll never use. You have to pay for your pregnancy costs, though you will never get pregnant, because the Affordable Care Act mandates you do. You could actually get rid of the strict insurance requirements that are found under Obamacare and allow people to more customize their plans for what they actually need, and rates would come down just because you wouldn't be forced to cover as much stuff. Obamacare also doesn't allow the pooling of coverage. If you've got a company and I've got a company and we're in the same business, we're not allowed to combine forces for economies of scale in insurance. We're not allowed to do that. Republicans could allow them to do that. There are some very simple things Republicans could do to begin to bring down costs. But also, contrary to the belief the media and the Democrats would perpetuate, the system we had before Obamacare was actually cheaper and better. More people were able to get more affordable health care insurance, and you weren't breaking small businesses. Remember, Obamacare was designed to break health care, to force people to want government socialized medicine. Republicans have had all these years to say they hate Obamacare, and they have not yet once come up with a plan to challenge it. It's time to change, and Republicans need a free market solution to lower costs.